For this building, our purpose is we wanted to create a space that simulated the work environment that the students were going to be in. We know in workforce education that the closer the simulation to the workplace, the better the education experience is for the student. So this building relies a lot on simulation, a lot on hospital-grade construction. Hopefully everything the student finds in the classroom or lab is exactly what they're going to find in the workplace. In some case, maybe even better than what they have in the offices.
A lot of materials, fixtures, other aspects of the interior environment are all intended to mimic work conditions and not necessarily just be spaces in and of themselves.
Well, the occupational therapy area has a simulated apartment with a kitchen, a bathroom, a bedroom, and everything. Those are the kinds of facilities usually a state-owned institution isn't going to have the funding for, and we were able to do that here and really create a facility like no other that students would find.
In the new building, the physical therapist assistant program has 2 spaces, and how we've set it up is one of our labs is actually modeled after sort of an outpatient clinic design. If you had hurt your ankle or your shoulder or your back and you were going to a physical therapy clinic, we've set up one of our spaces like that. Our other space is set up more like a rehab gym, which is what you might find in a space where you were staying in an inpatient, like in a hospital or a rehabilitation setting. So students really get a good sense for both the outpatient and the inpatient settings and kind of what that would feel like and how to work in that.
Yeah, we gave a lot of thought to how we designed the outside, the classroom spaces, the hallways, the public spaces, the gathering spaces, places where we might have meetings or events. We needed additional spaces like that.
I think more than the classroom is the outside of the classroom environment. I see my students, they're sitting here studying in different tables in the atrium, in the study areas. They're on campus more, studying together more, instead of previously it seemed like they were in class and then they would disappear and we wouldn't see them. So it seems to create it promotes a really great study atmosphere and allows them to say if I'm walking by or one of the other faculty is walking by, they can ask a quick question and we can help them with that too. So.
It's really been a rewarding experience taking the college's existing facilities and then suggesting a maturation, so to speak, and to suggest a new direction, which is also the direction that the allied health programs are having on campus.
I hope that visitors to the Allied Health Building will notice the modern look right away, and then I hope as they peek through the doors and start to look at the facilities, they'll see that, wow, this is really the best place that I could choose to come to study allied health programs. That these facilities look just like what I saw at my doctor's office or the hospital or wherever it is, and this is where I'd like to get an education.